Hello, my name is Fadi Alfhaily. I'm consultant gynecologist and I work at the Oaks Hospital in Colchester. It's my pleasure today to answer your questions which you kindly submitted through the Facebook.
So our first question we have is, I have very bad leakage. What can be done to help me?
Okay, so incontinence is very common. 1 in 7 women after 45, they will have some leaking episode. This can go up to more than 50 to 60% above 65 years. Leaking is not an age process. There's a lot of things we can do to help. Leaking can be related to some factors like parity, pregnancy, previous deliveries, some menopausal status, family history, and obesity. The most common 2 causes of leaking are what we call the stress incontinence. This is leaking with cough, sneeze, exercise, and this is more likely related to the lack of the support of the urethra, which is the tube we wee through, or the bladder. The main treatment for this one would be by doing initially pelvic floor exercise to strengthen the muscles, and then later on, once we prove it by special test called bladder test, we can do some surgery. And the type of the surgery can be minor surgery or could be a major surgery. The second most common cause is what we call overactive bladder. This is mainly related to the loss of coordination between the bladder and the brain. Usually would be also by doing some bladder retraining, some medication, and if this failed, the second line by stimulating the nerve coming to the bladder by doing what we call electroacupuncture, and then later on would be the last step by doing Botox injection through the bladder.
My periods are very painful, but I'm only 19. What can be done to help?
So pain during periods called in medical term dysmenorrhea, and this could be either primary or could be secondary. And primary means there's no underlying pathology, no underlying problems. Secondary, there may be some problems which cause this pain, and the most common problems are what we call endometriosis, which is the lining of the womb implanted outside your womb, or could be related to adenomyosis, which is the lining of the womb implanted in the muscles of the womb, or could be related to other fibroid or cysts. So the first line is to do ultrasound to investigate if there's any underlying pathology. If there's no underlying pathology, the treatment can be either by simple treatment by giving some painkiller during the heavy painful days of period, or we can go for suppressing the ovarian activity by either the contraceptive, whether the mini pill or the combined pill, or putting the Mirena coil. Of course, if there's any underlying problems, it needs to be sorted out by further investigations, and then depending on the degree and the disease itself or the lesion, then we can put further plan.
I am 40 years old and I have a family history of breast cancer, but my periods are very bad. What can be done to control the flow instead of taking the pill?
Thank you for the questions. So heavy bleeding is probably one of the most common presenting symptoms in the gynae clinics. Depending on the underlying pathology or the problems, there's different options we can offer to help women with abnormal heavy bleeding. Of course, depending on what's the risk, and as you mentioned, you have history of breast cancer, maybe hormonal treatment is not suitable. There's other options we can offer. So the simplest of options is by giving you some oral tablet. You can take them only during heavy painful days, like what we call mefenamic acid or tranexamic acid. If this failed, maybe the next options would be by doing a small operation by burning the lining of the womb. It's a simple operation called NovaSure. It's a very safe operation. Incision less operation will be done by using small device through the neck of the womb, through the cavity, and which will help by 92% by reducing your heavy days periods, and maybe around 33% you will have no periods. Of course, if this is not helpful, then the last options would be by doing hysterectomy.
How do I know what a prolapsed bladder feels like if I can't see it?
Pelvic floor organ prolapse can differ in degrees and types. It is very common presentation. Almost 41% of the women with uterus, they will have some degrees of prolapse. Around 38% of women who had hysterectomy, they may present later on with some pelvic floor prolapse. The prolapse can be what we call anterior wall prolapse, which is bladder wall prolapse, or could be posterior wall prolapse, which is what we call bowel prolapse or rectocele, or could be the uterus is coming down. Or if you had hysterectomy, that would be the top of the vagina coming down. Prolapse symptoms comes mainly by dragging sensation, feeling a lump from down below, uncomfortable, and feeling sore from down below. It could be also associated with some irritative bladder symptoms if you have bladder prolapse. So it's the physical examination which confirm all these symptoms, and depending on the degree and the size, then either surgical management can be offered or conservative management by putting a pessary, or we could go for expectant management if the symptoms are not affecting your life.